Back now with two quick updates on a story that began this broadcast last night, the predicted quick and rapid spread of swine flu in this country and around the world. The U.S. military considering a plan that could establish regional military teams to assist civilian authorities in the event of a major outbreak of the virus this fall.
During his speech at a National Press Club luncheon, the chairman of the House Judiciary Committee, Democratic Congressman John Conyers, questioned the point of lawmakers reading the health care bill.
I love these members that get up and say, read the bill. What good is reading the bill if it's 1,000 pages and you don't have 2 days and 2 lawyers to find out what it means after you read the bill?
Me, I'm like, get out of here, horses! Get out! They're coming to get you! And she's like, be quiet, I'm getting on the trailer. I like Obama. You know, up onto the trailer. And I'm like, no! Get out of there! And she's like, you're just a racist. She hears my desperation. You bet, lady, we may not win this thing. I'm going head up against pure evil, and you don't even know it exists.
Cory Bureau is giving her daughters the usual childhood immunizations. But if a vaccine against the new H1N1 becomes available, her girls will not be in line.
I don't want to have that kind of vaccination in my child yet until I know it's safe, 100% safe.
So yesterday, I know that government health officials met to decide who should get the vaccine first. Right. Who was at the top of the list?
So let's go through it. They went through 5 groups that they consider to be at high risk from complications if they were to get H1N1 virus. Top of the list is pregnant women. That includes women who will be pregnant at all during the flu season, and it is approved in all 3 trimesters. Anyone who takes care of babies under the age of 6 months. So this could be daycare workers, household contacts, older siblings, grandparents. That is an important category. Young adults and children 6 months to 24 years, anyone with an underlying medical condition, and anyone who takes care of sick people, healthcare professionals, emergency workers. These are the top 5 groups who will be prioritized to receive the vaccine first. Also today, a federal advisory panel is recommending that pregnant women be the first in line to receive vaccinations against H1N1.
The state is at the forefront of testing the new H1N1 flu vaccine. Testing the vaccine will begin with children ages 3 to 8. Now the testers are going to enroll about 200 children for that program starting August 17th. And children are the focus because they tend to spread the disease.
Looks like our government is getting us pretty upset and concerned about the swine flu. This is interesting to me not only for political reasons but also as a physician. It makes me think back to 1976, the first year I served in the Congress. We had a vote on the swine flu. Back then, there was a panic, and they said it was going to sweep the nation, and they rapidly came up with some flu shots, and the government was going to inoculate everybody and save the world from this disaster. And I remember there were 2 votes against it, myself and Larry McDonald, another physician. It turned out, though, that our instincts were correct. Not only did we object to it because we didn't think the government should be in the medical business and making these medical decisions, but it turned out that the instincts were absolutely right because the flu came and the flu went and 1 person died, except for those individuals who died from getting the flu vaccine. And over 25 people died just from getting the vaccine, and many got ill from it until finally they had to suspend the whole program. But here we are once again, the swine flu coming up, and everybody's panicking. Medical care in this country is deteriorating and the costs are skyrocketing, mainly because we have had central economic planning in medicine now for 30-some years. It hasn't worked very well, so now we're about to embark on socialized medicine.
Yesterday, healthcare executives indicated to the White House that they were going to slow the rate of growth over a period of 10 years, thereby saving $2 trillion. Wake up, America. You have to look at the underlying numbers here. What it means is that their share of revenue for all healthcare spending is going to rise to $12.8 trillion by 2020. 1.5%, slowing the rate of growth times 10 years, 15%. You multiply that times your 12.8 trillion, you get about $2 trillion. This is a hoax. It is a swindle. They're trying to tell the American people that these insurance companies that make money not providing health care are suddenly going to give the American people a break, when in fact the rate at which we're going to be paying is going to be 35% more than it is now. Wake up, America. The only plan that we can have that can work is universal, single-payer, not-for-profit health care. Break the chains, the shackles that these insurance companies have on our political process. Yield back.
An investigative journalist from Washington, Wayne Madsen, says the outbreak of the virus is raising suspicion.
I spoke to two journalists, one from Mexico City and the other one from Jakarta, Indonesia. And of course, Indonesia had a problem not long ago with bird flu. Both these journalists have been in touch with UN and World Health Organization officials, including a scientist who's dealt with Ebola virus and HIV/AIDS in Africa. And it's their conclusion, these scientists who they've spoken to, that this is a very unusual form of flu because it looks like it is a product of some gene splicing. The flu contains elements of bird flu, two forms of human flu, and various forms of swine flu. To them, it doesn't look like this is naturally occurring. The other thing is the target for this flu, as opposed to other flus, it's not the very young and the very old. It's people between the ages of 20 and 45. And the other thing is people are not contracting this from pigs. The National Pork Council here in America says pigs are not being affected. This is human-to-human contact. So people who either eat pork or are exposed to pigs are not getting this flu. Very unusual, and of course the scientists are very alarmed by the way it's being spread and the speed at which it's being spread.
We told you from State of Texas documents that I received from a city official here in Austin directly into my hand. And of course, we can't give you that source, or we'd lose those sources. But I posted the document, the secret document, with phone numbers. I'm blacking out the name of who gave it to us, that the state of Texas had a meeting with the feds. This is when we were at level 4, and they said we're really at level 5, going to level 6 in 96 hours. Under that, we are officially under global martial law, forced inoculation, forced arrest, quarantines, mass graves. All of this could be implemented.
It's the vaccine that can't come soon enough. Development of a swine flu jab is expected to be complete by August, but clinical trials mean it probably won't be ready for public use until the autumn. And now, according to The Independent, those first doses could be given out before results verifying its safety are even available. Scientists have been working on a swine flu jab since April. The government has already placed advance orders for up to 132 million doses of the vaccine. On its completion, it's thought trials involving 200 to 400 patients are to be conducted.
I don't need another flu shot. I had a flu shot last year. A swine flu epidemic may be coming.
This public health advert is from America's swine flu scare of 1976.
Swine flu? Man, I'm too fast for that to catch me.
Then a vaccine was released before extensive testing. And while swine flu only killed one person, side effects from the jabs caused 25 deaths.
Get a shot of protection. The swine flu shot.
I'm very concerned that a vaccine might be brought out too quickly. There's a huge demand for it from doctors and patients, and yet it hasn't been fully tested. We know from the past that these types of vaccines can cause neurological disorders, and there is an overall concern that if a vaccine is used too soon, it may have more problems than swine flu itself.
Setting aside the sheer illogic of adding a new tax burden to businesses in the midst of a recession, this brilliant idea is sure to accomplish one thing: job losses. Now, I've done the small business thing, and I can tell you it costs a lot to offer health care to your employees. Sometimes you just can't justify hiring someone and paying for their health care. If we're forced to cover health care in order to hire someone, we're guaranteed to be hiring fewer people. And if Congress is trying to claim they're doing this for the low-wage workers in America, what do you think is going to happen when a small business can't afford to pay 8% more for each of their minimum wage employees? They'll have to start letting people go. It just blows my mind that this is the best they can do. That instead of looking at ways to reduce costs so more Americans could afford coverage, their knee-jerk reaction is to tax our businesses to fund some crazy, convoluted, ultra-expensive, government-run, I don't even know what you call this. And look, I want people to be able to afford health care. I just don't see how that can possibly remotely happen if every move Congress makes increases the burden on our already stressed small businesses.